Oh, I want to tell you, I used to work at St. Helena Hospital. Some of you know that, yes? I was there for 16 years, and it was a very good experience. I had very many fond memories of it, but there were reasons that I left, and many reasons. You know, it just is a lot of things that kind of build up over time. But one of the reasons that caused me to leave, I'd like to share with you one of the experiences I had that was kind of interesting. I don't go to noontime conferences. I stopped going many years ago. I don't know whether you still go. I guess the free lunch is worthwhile. It's hard to shell over $2.50, right, for a lunch. I don't go. I don't go. Because you know what? It's an insult to my intelligence to have a drug rep sit in detail lecture to me. But I was at the hospital a few years back, and I saw a title of a lecture. It was Diabetes is Caused by Fat, Not Sugar. Oh boy, somebody's got it. We got to go listen to this. So I gathered all my staff together, and we went down to the lunchroom. And we walked in, and my first clue that there was a problem was the Pfizer representative was sitting in the back of the room. And then the speaker walked in, and he was obese with acne, greasy skin, and a ponytail. So I thought this is going to be a long hour, but you know, who knows? Who knows? It could be, who knows? I get surprised all the time. Well, anyway, I sat down and listened for a whole hour to the presentation. And listen to the man tell me how to properly take care of a diabetic. And I counted. I finally got to listing all the drugs he said I needed to use to care for a diabetic. I needed several types of oral medication, maybe some insulin. I needed to put them on a cholesterol-lowering drug. I needed to put them on some calcium channel blockers, some ACE inhibitors. Oh, always got to be on ACE inhibitors to protect those kidneys. And it went on and on and on. And finally, I had a list of at least 20 drugs that a well-treated diabetic should be on. And he made it sound really good because it gave it a sexy term. He called it polypharmacology. I could just hear all the doctors going, "Ooh, I'm practicing polypharmacology." Oh, boy. Anyway, I waited till the end of the presentation, and I raised my hand. I said, "Hey, doctor, the title of your lecture is Diet is Caused by Fat, Not Sugar." I said, "Did I miss something? You didn't mention diet once in the entire hour." He says, "I got you here, didn't I?" I said, "Yeah, you got me here." I said, "But you know, a lot of the drugs you mentioned," I said, "they kill diabetics, like sulfonylureas and calcium channel blockers." And, you know, about that time, one of my mentors, and somebody you probably know, somebody who was the head of my health center at that time, John Hodgkin, jumped up and apologized for my behavior. In a very politically correct way, may I mention. Yes, he was very good about it. Said, "This is Dr. McDougall. He writes health food books. You know, you have to excuse him." So, anyway, I made a few other comments, and then we're walking out of the room together. John and I are. He's a good friend, still is a good friend, and we're walking out of the room together. Some of you know him. He's a great doctor. And I looked over at John, and I said, "You know, our colleagues don't believe, really, they don't believe that's the way you treat a diabetic, do they?" He says, "Yes, we do." That moment, I decided I did not want to be associated with my colleagues anymore, because that's not the way you take care of a diabetic or any patient. I mean, think about the patients you take care of. They're not on one drug. They're on a bag full of drugs. They're on something for blood pressure like Norvasc, calcium channel blockers, which are very deadly, increase the risk of dying of heart disease, cancer, breast cancer, suicide, and bleeding. Blood sugar medications, cholesterol-lowering medications, something for uric acids like Xyloprim. Homocysteine, that's a good one. Folic acid, we just saw 2 large reports that show that it increased the risk of heart disease and death by about 30%. Triglycerides like Lopid, you no longer put patients on aspirin that you can buy 50 for a penny, do you? No, you got to put them on $4 aspirin called Plavix, which increases the risk of stroke and other breathing problems. But believe me, they've paid for studies to make sure that we do those things. Something for your body fat like Orlistat, headaches like Darvocet, body aches, indigestion, you give them something from an antacid. They're all on antacids, right? And then they're constipated, put them on Miralax and something for diarrhea, and they stink so bad from all the meat they eat, you got to put them on deodorants. I forgot one drug, and I'm sorry, I forgot to mention. If they keep complaining and keep coming back, because you know you're supposed to cure them as a doctor, when they complain so much you're just sick and tired of listening to them, what do? Put them on an antidepressant, right? Yeah, that always on antidepressants. Okay. I want to introduce you to a patient. This is somebody I've known for a while. This man, he knew he had some problems, so he decided to go to the doctor, and he was diagnosed with high blood pressure, type 2 diabetes, hypercholesterolemia, hypertriglyceridemia, gout, mild kidney failure, overweight, mild osteoarthritis, constipation, depression. I'm not exaggerating. This is true. I mean, do you know any patients like that? Of course you do. So he went to the doctor, and he went to the doctor for 2 years and paid, the monthly office visit, paid thousands of dollars for medications, and followed the advice strictly for 2 years. And what I want to show you now is a picture of him 2 years later. He still has high blood pressure, type 2 diabetes, hypercholesterolemia, hypertriglyceridemia, gout, mild kidney failure, overweight, arthritis, constipation, depression. Okay, now here's the trick question. What do you see different about this man? What miraculous change do you see that's taken place in 2 years? Nothing. He's still just as fat and sick as he was 2 years before. Now I ask you about your patients, your friends, your relatives, your patients. You tell me what happened when they underwent good medical care. Nothing. They're still fat and sick, and now they're carrying around a bag full of drugs. And that is it. And if you are a doctor, you must believe you're doing some good because you cannot see it. Somebody want to challenge me? I tell you, John, you should have invited me.